afternoon and welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, as well as the PACE program. Today I'm excited to have with us today, Dr. Maria Livshin. She is a gastroenterologist with the Cambridge Health Alliance. Welcome.
Thank you so much. Great to be here.
I'm so glad because, intestinal issues are very prevalent out here for any one of 100 reasons, and we want to make sure that that we address them.
Absolutely.
Right? So I know, if I may ask you, this GERD thing, the acid reflux, it seems like everyone and their brother has GERD. Why is it so prevalent?
Absolutely. So it's true, about up to 20-25% of people have GERD. And what is that? So GERD is when you have a refluxate of stomach contents that come up into your chest and sometimes into your mouth. And this can cause symptoms. So it's normal to have some amount of stomach contact come up into your esophagus, into your food pipe, and then up into your mouth even sometimes. But it is not normal to have this associated with symptoms.
So what kind of symptoms?
Yeah. So what can people feel, right? They can feel a burning sensation, and sometimes they'll even show this, the hand going right up, because that's what they feel. This acid is coming right up from the stomach.
They can feel it moving.
Exactly. Yeah. It's creeping up on them and causing this burning. Sometimes they feel a sour taste in their mouth, regurgitation. You can feel the acid and some of the undigested food that people may have just had. Also, sometimes people can have hoarseness, so a hoarse voice.
Really?
Yeah, absolutely.
Oh, that I wasn't aware of.
Absolutely. And then there can be other symptoms like a dry cough. So
really?
People can be coughing, but it may not have anything to do with their lung disease. It may actually be from the stomach acid that comes up.
Well, no, I've never heard that. That's why we do this show.
So that is just the beginning. So if you get me going, also, people can have a feeling of food getting stuck sensation.
Yeah.
And that is a very
like a bunching kind of a...
Kind of like a bunching, or you feel like it just won't go down. It's a lump that just sits there and the food won't go down.
Is it usually like directly after you eat?
Exactly.
Oh.
And then sometimes people will even feel it for a long time. Half hour, an hour, several hours. May need a glass of water to help this block go down, and sometimes even that won't help.
So let me ask you, is it the food that's bunching, or is that just a feeling that they get?
Well, it can be both.
Oh, there's no easy answer.
There's nothing straightforward in medicine. It can always be this or that.
Right.
So what happens is that sometimes people have with this chronic acid that comes up, and if you can imagine, if it's burning the lining of the esophagus, which is your food pipe. So let's take it back just one notch. So what happens when we swallow? What are the organs? So our tongue helps to push the food back, and we have muscles that help us with the swallow. Once that happens, food goes down into this long tube. It's about this long, called the esophagus. It's just a long tube, like a pipe made of muscles. And that pipe helps us propagate down the food or the liquid that we've just eaten. And then it enters the stomach. After the stomach, it goes into the small bowel. After the small bowel, the colon, and then out. And so for GERD, or the symptoms of these refluxate from the stomach contents that come up and provide symptoms, we're talking about mostly the esophagus, this food pipe. And so if you have long-term, for many months, many years, this acid that comes up, it causes burning to the lining of the esophagus. And as a result, you can have inflammation, which can make it feel like food gets stuck. You can also have something called a stricture. And a stricture is a fancy word for narrowing. So you can actually get narrowing of this pipe, which makes it a lot easier for the food to get stuck when you eat.
So I've heard of people having to have that stretched, and that would be the reason why?
Absolutely.
Because it actually has got narrow, and then we need to open it up so the food can pass?
That is absolutely correct. So if you have it tight and narrowing, you do need it stretched, and that can make a significant difference. And sometimes people don't even realize it, that they have this problem until they hear it, or on an occasion, a piece of food will get stuck and really won't go down, and people will have to actually have a bag and spit out their saliva because it just won't go down. The tube, the esophagus, is so filled with food.
Wow.
So in that situation, actually,
That sounds like it needs to be addressed immediately.
Absolutely.
Is that a trip to the ER?
That is a trip to the ER, and that is something where I'll get up at 2 a.m. and go to the hospital to treat that patient to get that food out, because letting it sit there can actually be very dangerous.
So let me ask you, people, if they have it for a long time, you might have this and not really know that you have this, right? It seems to me. But so, indigestion, we all are familiar with indigestion. Do you get some of those same symptoms with indigestion, so people might pass it off as indigestion?
Absolutely. I think the main issue is that if you have these symptoms of in what you may be calling indigestion for a long time, it's not just a week, few weeks, maybe even a month. But if you've had it chronically for years, it is definitely worth mentioning to a primary care doctor who can begin addressing it, and if needed, be sent, given a referral, and be sent for evaluation by a gastroenterologist.
Right, because I can see that are there any other, well there are, because I know that an ulcer can also give you that kind of same sensation. So I think it's always worth mentioning to your primary. If you have something going on like that, it's not normal. Something is causing it, so it's always worth mentioning it, right?
Absolutely, because if you don't mention it, you may think it is normal, but it's always good to double check. If you've had a symptom for a while, you've been thinking about it, your husband or your wife mentions and tells you that you should mention it to your doctor, certainly worthwhile bringing it up.
Right, and I know a lot of people, especially in the elder generation, they don't want to bother the doctor, but you know what, better to be safe than sorry and to let the doctor know that this is going on.
Absolutely, and just there are 2 additional things I'd like to mention. One is that if for people that have chronic acid that comes up and burns their esophagus, what can happen, and by chronic is 5 years, 10 years, more than that, one of the problems that can happen is a development of a condition called Barrett's esophagus. And in that condition, it's a response of the lining of this food pipe of the esophagus to this constant acid. And this lining begins to change, and it's a precancerous change. And if you don't pay attention to that, it can develop and progress into cancer of the esophagus.
Wow.
So it definitely is a serious matter.
Definitely worth mentioning, definitely. So with all this acid, because acid eats holes, so can it ever cause like holes? I mean, I know it causes narrowing.
Right.
And it causes if it goes on that Barrett's, you said?
Barrett's.
So can it cause actual eat holes in the esophagus?
Well, yes and no.
Oh.
So,
Yes.
no straight answer. So yes, in a way that you can predispose to an easier, the lining can be thinner, especially if you do have that narrowing, you eat a large piece of food, for example, it is stuck, then there can be a lot of pressure. And of course, with a lot of inflammation, the food pipe can become diseased. And then it is, of course, a lot easier for it to become perforation. Generally, it's not often that you will have a rupture or perforation of the esophagus just from chronic acid.
Well, that's good to know. That's good to know.
Absolutely.
And what about medications? I know that there are medications. Things like over the counter, like a Tums or a Maalox or those shocking things?
Absolutely. So all of those are very useful medication. And before the development of medications, especially medicines like proton pump inhibitors, and you can see these over the counter like omeprazole or Prilosec. Absolutely, the Prilosec, the Nexium, the Prevacid that you can get over the counter. Before that development, many more people used to have strictures and narrowing in their esophagus and have difficulty being able to eat food without it having be stuck.
So those medicines, do they neutralize the acid, or is that what they do?
Well, it's a great question. And again, yes and no, depending on the medication.
I don't know why I asked these questions. Yes and no. Okay.
So there are certain classes of medication. So the very basic is the antacids. So this is something like Tums or Rolaids, for example. And these medications, all they do is neutralize acid. So if you feel that burning, let's say that there are certain foods that also promote acid. So let's say you had a cup of coffee and now you feel that burning in your chest and your inside in your esophagus. At that point, you can take a Tums, for example, that will neutralize this acid. It usually works within several minutes, but it lasts only a short duration. And so if your symptoms of this burning sensation are only about once a week or so, just rarely, a few times a month, it's perfectly fine to take that medication. If you have symptoms several times a week, at that point you may need to have medication that's taken on a more regular basis. So something like a ranitidine, that's what you were mentioning earlier. So that's Zantac or Pepcid. Those are the brand names that you can buy over the counter. The way these medications work, they're usually best if taken twice a day. And the way that work is they work on one of the hormones. They're called H2 blockers, histamine type 2 receptor blockers. And so they work on one of the hormones that secretes stomach acid. And by blocking that, they help to control the acid in the stomach. Now, there's even a more powerful, in a way, medication, and that is something called PPI, a class of medication called proton pump inhibitors. And you can get that over the counter as well.
And what would you call it over the counter?
So Prilosec or Prilosec OTC. And the OTC...
Yes, I've seen that.
That stands for over the counter. So it's an acronym. Who knew that, right? You need a dictionary for anything medical, including even the over the counter abbreviation. Or the Nexium, for example, the purple pill. You can get Prevacid is another one. They can also purchase over the counter. So the way these medications work is there's in the lining of our stomach, there's a pump that secretes acid into the stomach. And so these medications...
To digest the food, is that what it's for?
Yeah. Absolutely. So this medication, what it does is that it actually blocks those pumps from working so that we don't make acid.
So does our food still... What happens to the digestive process then?
So one of the jobs of the stomach is to actually churn this food and mix it well together before it passes it on to the small intestine or the small bowel where most of the absorption happens and some digestion and absorption. And so we find that for the most part, people have no problems absorbing and digesting their foods even on these medications.
Oh.
But they can be tremendously helpful with the symptom control.
Right. So, go ahead.
One caveat I was going to say is that if you purchase an over-the-counter medication, it will say use for these this class of medicines called PPIs or proton pump inhibitors. They will say use only for 14 days. There's nothing wrong with using it for longer if you need to, and the reason that 14-day disclaimer is there is because for something over the counter, the thinking is, the logic is that you don't want to be self-treating with a medication.
And that was going to be my next question. Should you just go ahead and buy those things and take it, or should you always check in with your primary?
I think you should always check in with a primary, and this is the one time it's not a maybe answer.
Right. I thought that was going to be the answer, but I thought I'd check it out anyway. Okay, so there's a lot going on in the digestive tract and the esophagus with the acid reflux. Indigestion, does it work in a similar fashion?
Absolutely.
It does.
Absolutely. And the question becomes also, where is the problem? And that's going to depend on some of the symptoms that a person is having, because it doesn't have to be in the food pipe and it may not be acid. Sometimes people can have a problem with what we call motility or the function of this muscle. For example,
this muscle?
Correct.
What muscle?
The
this
esophagus.
muscle.
Correct. As I'm a gastroenterologist, I only think of GI muscles.
We don't think, I was just going to say, we don't think of the esophagus as a muscle, so.
Absolutely. In fact, the whole intestinal tract is a muscle.
The whole intestinal tract is a muscle. Well, you've heard it here.
So, with that said, people can have, I'll give you an example. So people can have pain in their chest. And of course, we always worry about heart. Is it a heart attack?
Right.
And the first thing to do is check with your primary care doctor, check with a cardiologist, because if it was a heart problem, well, you don't want to let it go. The consequences are too significant.
Absolutely.
And once your heart is checked and your cardiologist or your primary care doctor are happy, they don't think it is your heart, but you continue to have chest pain, it could be the muscle of the esophagus that's causing squeezing or abnormal has abnormalities in its movement, and that can be giving you pain. And that is, again, something that you can check with a gastroenterologist to find out.
So it is always important not to just slough off these things if they persist. You know, once here and there it might be an occasional thing.
Absolutely.
But if you have these symptoms often or chronically, then it's definitely, it sounds like for more than one reason, it's definitely worth checking out. And also to rule out the heart attack, because I know that they say common symptoms of a heart attack is that feeling of indigestion, but not necessarily in women. It presents differently. So
Absolutely.
we don't want to take the chance. It's not worth it.
It's not worth it. Ask your doctor.
Right, ask your doctor. So what other so an ulcer, stress causes problems in our everything. But definitely if we are stuffing any emotions or anything, we're dealing with it, if we bring it inside, then we can have a lot of these, a buildup of acid, right?
Right, and there are also, it's important when you're thinking of stomach ulcers or what we call peptic ulcer disease. It is also important to know that some of your medications may be causing this. And certainly people have long lists of medications. And sometimes over-the-counter medications are not mentioned to your doctor, and they cannot even, you don't even have to think about it. Oh, it's just something I take. It's little this or little that. But all of these medicines can cause problems. Even herbals and supplement medication can cause problems.
I know, I take very few meds, but my list of herbals is long. But the doctor needs to know that.
Absolutely.
So they can interact with other things.
Absolutely. And the common medications that can cause indigestion or ulcer, those include aspirin that many people take for their heart. And then also a group of medications called NSAIDs. These are non-steroidal medications for that fight inflammation. So this is like Motrin or Aleve or Advil, ibuprofen. It's that group of medications that can cause ulcers.
So like naproxen, is that a different group or
No,
same group?
that's the same group of
Anti-inflammatory.
Anti-inflammatory medication. These are the medications you can, for the most part, buy over the counter that are non-Tylenol or acetaminophen. And all of these medicines, they can cause inflammation to the lining of the stomach and ulcers. And then also, if you drink alcohol, especially regularly, if you smoke, that risk increases. And then there's also a bacteria, which you may have heard of.
Oh yes, H. pylori.
That is correct.
H. pylori, yes.
The Helicobacter pylori bacteria, which is very prevalent, it is very common.
They haven't known about that for really, in the big scheme of things, for a very long period of time. But there is a medicine that you can take to kill off that bacteria.
Absolutely. And that bacteria, we don't check it in people who don't have any symptoms. Otherwise, there'd be too much medicine to pass down. But if people do have symptoms, then we do talk about treatment of this bacteria.
Is it a blood test? How do
So what does it do, right? Let's start there. What does this bacteria do? So it can cause stomach ulcers, inflammation of the stomach cancer. Now that's not common, but because so many people have this bacteria, it does happen. And then also there's a type of a blood cancer called a special type of lymphoma that people can get from all associated with this bacteria.
So how do we get that bacteria?
We think we call it ubiquitous, which means it's kind of around in the environment, but how exactly does one get it? We're not quite sure.
Don't know.
No answer to that. Or when we get it, that's unclear also. It's very prevalent in U.S., but countries outside U.S., developing nations have even more of that bacteria. It's even more common. Correct.
So, and now the doctor is wanting to rule that out. So, is it a blood test that we can, or how do we find it?
Yes, and there are several ways of checking if you have this bacteria. There is a blood test. You can only check if somebody has never been treated for this bacteria. You can use a blood test, although the latest guidelines from American College of Gastroenterology suggesting that perhaps is not as good a test as some of the others.
Oh.
So what others, right?
Yeah.
What can we do?
That was my next question.
So a stool test. As unpleasant as a stool test is, a stool test to check for this bacteria is actually an excellent way to find out whether you do have it or not. The only caveat is that you have to be off a proton pump inhibitor. Remember the medicine for the stomach acid, for that GERD, that heartburn? Usually for about a week or 2 weeks to improve the actual result of this test.
Well, that's true. Anytime I've had a colonoscopy, they tell you to stop taking these medicines for 7 days prior to the test. And I guess that would be...
Certain medications, not quite this one, but you're right. There are certain medicines we do tell you to hold off. You're absolutely right in this sense.
Yeah.
But to get back to the H. pylori question, so the stool test, again, it's an excellent test. There's also a breath test that you can do.
Breath?
A breath test, correct. You need a special machine, which is
Yeah.
usually a gastroenterologist or a hospital laboratory will have. And you drink a certain substance. The bacteria breaks this down if you do have it, because these are what's called urease digesting bacteria. And so when you breathe out, you can tell whether you have this bacteria or not. And then the final way to check is actually to do an endoscopy, a look with the camera inside your esophagus, inside your stomach, and take a look. You can take biopsies and check whether you have this bacteria or not.
Wow, that's certainly interesting.
And
So,
one last thing, the treatment of the bacteria,
yes,
if I may mention, and that is difficult.
I know it's not pleasant.
It is not pleasant for certain, but this bacteria is very hard to get rid of. It lives in an environment of stomach acid. It's a rough
It's
guy.
happy there.
It's happy there. It's hard to get rid of this bacteria, but you take a course of antibiotics, and it's either three. It's a combination of 3 or 4 pills and 3, sometimes even 4 antibiotics that you have to take for about 10 days.
Is that Flagyzole? Is that what that's called?
Metronidazole is typically one of the medications that we commonly give, and it is a difficult antibiotic to take, but you just have to suffer through it.
Right. It will be worth it in the end, because as you
Absolutely.
mentioned, H. pylori could be cause cancer.
Absolutely.
So we definitely want to get rid of that. So, we've only just scratched the surface with intestinal. I might have to bring you back for part 2. Some common problems would be bloating, or and that would be gas, or foods we eat.
Absolutely. That can
Mhm.
definitely be part of it. For example, many people are lactose intolerant, and that is they're unable to digest the natural sugar that's in milk and milk products.
Right.
It's actually not even considered a disease. It's something that can just happen. You can lose that ability. It can happen at any age. Sometimes you may have an infection that kind of incites this, but not always. It can just happen. And so the natural sugar molecule in milk products, it's made of 2 blocks, if you can imagine. And inside the lining of our small intestine, we have this enzyme, a scissor, that can cut the connection between these 2 blocks, and then these 1 sugar molecules we can absorb. And so we can utilize that for our energy. But if you're missing that scissor, then what happens is this 2-block sugar molecule, it stays inside our intestine, and water comes in, and then as it passes down further in our intestine into the colon, into the large intestine, what happens, the bacteria there, they see these sugar molecules as their food. So they start digesting it and release gas and make us feel bloated. So one may have burping or bloating or gas or flatulence, as well as loose stools or diarrhea. And this can all just be from an inability to digest milk products.
Does nausea usually come with that as well?
You can have that as well. Not always, but
Not
it is
always,
possible.
but you can.
Absolutely. And sometimes people will say, yes, of course, I can drink milk. But then they put a little bit of cream in their coffee, and they may just be enough to give them the symptoms.
Right. And so we have to really pay attention to where the milk products would be. Not, cheese. Right?
Absolutely.
Everything.
Well,
And yogurt, maybe.
Right.
And any other products that we might eat, why it's so important to pay attention,
Absolutely.
especially if you have an intolerance to something.
And some people actually can have a pretty strong intolerance. And think of butter, or going out to a restaurant. You may be doing a really good job of avoiding these products at home, But when you go out, when you go to a restaurant, butter makes everything better. And many restaurants will use butter to enhance the taste. And people may notice that they may have more loose stools or more bloating after they go out. And that could be one of the reasons.
Could be one of the reasons. So let's see. What else would be important to mention? Gallbladder, would that be important to mention?
Absolutely. You can live without your gallbladder, but it is important.
I'm living proof.
So gallbladder, it's located, so where is it, okay? It's on your right upper abdomen, right upper side. And so it's sitting kind of right under the liver. And it's tucked in nicely there. And of course you can live without a gallbladder if you have to, but if your gallbladder works well, then of course leave it in. The problem that people can have is that they can form stones inside their gallbladder. There can be various types of stones, but cholesterol stones are the most common type.
What kind?
Cholesterol stones.
Cholesterol stones.
Cholesterol stones, correct.
The buildup of plaque?
Correct. So
Same
in a way,
thing.
it builds up and then it causes this formation of these stones inside the gallbladder. And it's fine to have the stones. Just having the stones, it's not the problem.
Okay.
The problem becomes if these stones want to come out, then they can cause a blockage.
They move through the decks, or they try
Absolutely.
to. That's where the
exactly
pain is, right?
That's exactly
I speak
right.
from personal experience. So it's cholesterol stones and not calcium?
So more typically, the more common ones are the cholesterol stones that we get in our gallbladder. You can have pigment stones, but those are more common in Asia with certain conditions. And just to, why do we need gallbladder? If we step back just a little bit. So one of the main functions of the gallbladder is to concentrate bile. So bile, the substance, is made in the liver,
Right.
which is right here above the gallbladder. And that bile is made so that we can absorb the fat in our diet. Then this bile flows through the passageways. And the passageway for the liver and the gallbladder, we call them bile ducts.
Right.
Just a fancy word. And so this bile flows into our gallbladder, and the gallbladder concentrates it, makes it more concentrated. And then when we eat something fatty, the gallbladder squeezes. It's just a little round or oval structure. It squeezes, and again, through the passageways, through these bile ducts, this bile goes into our small intestine where it helps us absorb the fat in our diet.
Well, I'm afraid we've run out of time. So I think I'm going to have to bring you back to talk about other. I think we've only scratched the surface with intestinal, have we?
Oh, just the
We've only scratched the surface. We'll have to do a part 2 with Dr. Livshin. But thank you so much for coming on board, and I'm sure this will be helpful to everyone. And then stay tuned for part 2.
Thank you. It's a pleasure.
Thank you so much.